Hi, my name is Kent Johnson, and the exercise we're going to demonstrate today is what we call a median nerve glide or median nerve thrust. Now, what happens is that sometimes some of the tension that you actually have coming out of your neck and going down your arm, and you may think it's because the joint is restricted or the muscles are tight or restricted. It's actually nerve tension. It's what we call dural tension. So there's two ways to do this. For those of you that actually have pretty significant tethering of the nerve, you're probably going to need someone to assist you with that. That's the first one we're going to demonstrate. Okay. So now, before we do this, most likely you're going to have some sort of discomfort doing this. Okay, because we are actually working with the nerve. We do not want anyone to get injured, so you have to go very easy. The patient, the person that's actually having this done to them, must be very vocal about what's happening and telling the assistant, whoever's assisting them, to go slowly. If they have any sort of discomfort, everybody has to be communicating to make sure nothing happens that actually irritates the nerve. So the first thing we're going to do is we're going to actually go ahead and we're going to work on the left side here. I'm going to externally rotate the entire shoulder, okay? Extend the wrist. These two first fingers and the thumb is where my focus is. I'm pulling those back. Julie is now going to drop her shoulder blade down. Excellent. She's going to extend her shoulder and her arm. Now she's going to retract her chin. And she's going to laterally flex to the right. And as she does that, if she has any sort of tethering, she's going to feel tension going down her arm and into these two fingers or the thumb. Okay? She's going to do that 3 to 5 times. And she'll come all the way back. Good. And this next one, Julie, come all the way back towards me. All the way, all the way. There you go. And then go ahead and go back. Stay right there. Now the patient may have a tendency to hike the shoulder up, so you have to drop it back down again. And do that one more time. Good. And go to your right. Excellent. Good. All right. Now in the beginning, you're going to go ahead and do that 3 to 5 reps. Now I would like for the patients to actually do this 2 or 3 times a day. As the patient starts to go ahead and loosen up through the neck and the nerve starts to slide, because she have 2 centimeters worth of slide, then the patient will need less assistance from someone in the household or at work, and they can actually do this on their own. So Julie's going to demonstrate that. So she's going to externally rotate her shoulder, pull her wrist back. You see how she's nice and loose through there. She's going to actually pull her arm back, drop the shoulder blade down, and now she's going to laterally flex her spine. Excellent. Back and forth. So this isn't resistance training or yoga or something like that. You're stretching and sliding a nerve through the connective tissue. So you have to take it easy. Don't move into pain. If you're really starting to get increasing symptoms in the fingers or going down the arm and the neck, then you need to go ahead and stop and actually call us.